My name is Joanna Keogh, and I will be reviewing mechanical lumbar traction. Benefits of mechanical traction include a well-controlled traction force and time, distraction of joint surfaces, a longitudinal pull that can reduce the pressure on intervertebral discs, and tensing of the posterior longitudinal ligament, which can help push back any posteriorly displaced discal material to its original position. Before considering mechanical traction, patients must be cleared of any contraindications or precautions. Contraindications include instances where motion is contraindicated, peripheralization of symptoms during traction, uncontrolled hypertension, and instability or hypermobility of joints. Precautions include structural diseases affecting the spine, when pressure of the belt may be hazardous, when there's a displaced annular fragment, a medial disc protrusion, when severe pain fully resolves with traction, claustrophobia or other psychological aversions to traction, when patient can't tolerate the prone or supine position, and disorientation. For lumbar traction, we will set our parameters to intermittent for a total of 15 minutes for our first treatment time. Subsequent treatment times can be 20 to 30 minutes. We will remove any progressive or regressive steps. We will set our maximum force traction to 25% of the patient's body weight. We will set a minimum relaxation force of 10 pounds. You don't want a total release of force because it can result in rebound aggravation of patient's symptoms. We will edit the hold times for 60 seconds and the rest time for 20 seconds. We will set the speed to 50%, and then we can start the treatment. Since the patient has a posterior disc protrusion of the intervertebral disc between the vertebral bodies L4 and L5, I will have the patient lying prone with the hips in neutral in order to target the lower lumbar spine. Before the patient is instructed to get on the table, the therapist must ensure that the table is locked. I please have you laying down with your stomach down. The therapist will ensure that the iliac crest is in proper alignment with the lumbar belt. We will put a bolster under the patient's feet in order to ensure comfort. Then we will begin securing the lumbar belt. We will secure the belt strap with the O-ring in the center. Then we will secure the thoracic strap. Next, we will attach the J-hook to the O-ring, release the rope, and then release the rope's tension. The therapist will give the patient the call button in case she needs to stop treatment at any time. Then we will unlock the table to reduce friction during treatment. Then we can begin the treatment. Within 5 minutes of treatment, the therapist must check on the patient to ensure that they are still comfortable and there's no problem. Now that the treatment is over, we can stop the machine, ensure that it goes all the way back to 0 pounds of traction. Then we can release the rope. Lock the table, remove the bolster, and unhook and unstrap the patient. The patient should be instructed to get up slowly with the therapist's help, especially for the first time, to decrease any dizziness or lightheadedness. Call button back. Okay, please get up slowly. Do you have any lightheadedness? Are you feeling okay? Now treatment has ended. Expected outcomes of mechanical lumbar traction include decrease in the size of the disc protrusion, decrease in the pressure on the spinal cord by increasing the space in the spinal canal, and decrease in pain, discomfort, and any other symptoms related to disc pathology.